Now it's my pleasure to invite our guest of honor, Dr. Fei-Chau, Commissioner for Primary Healthcare, Health Bureau, Hong Kong S.A.H government, to give the keynote speech. Dr. Pan, please.
Professor Yu, Dr. Lam, Dean Chiu, Professor Wong, Linda, and Mr. Hong. It's really great that I can come here and share your happiness to celebrate the launch of Phase 2 JCSATH. Good morning. This is my home school. Dean Chiu now is, I'm proud of our classmate Dean Chiu, who can be our dean and lead us to have a very good result in the QS ranking just released yesterday. And we are so happy that we can share how the success of CUHK. And also CUHK launched so many projects. JCSATH, I think it's really a good project, and I can learn a lot from my teacher, Professor Yu, who teach me how to build the system. And also I learned from Dr. Lam, who teach me how to disrupt the system. Because we need to build and disrupt. And also, I'm also admire Professor Chiu, who always look young with very good mental health, and also how to keep that, because all our classmates want to learn from him. Today I would like to highlight a bit on the primary health care, because after the issue of primary health care blueprint, we really try to build a system out of nothing, whether we can have a primary care system under public system, under public-private collaboration, as well as how we can have some degree of impacts on the private system development, so to develop more healthcare access to people in Hong Kong and enhance our health. The issue is when we established Primary Healthcare Commission last year in July 2024, we all share a lot of common understanding with the community how to develop the family health, because we think that individual health is inseparable from individual at home, which bring a very important concept, because in healthcare system in Hong Kong, we always take care of the individual. We don't screen the family members of people who are sick and diseased, even though they have higher risk. For example, we won't screen the family members of hepatitis B carrier, although they are high risk. We won't screen the family members of people who had the breast cancer. Also, you mean that the family is really important when we deal with the health care. However, how can we do that from primary health care? Family doctors for all is a concept, because it's a system we want to build. It's not only the family doctor, it is the people we work together. But we understand that in the healthcare system, without the leading role of the doctors, we can't drive the move. So we built our district health center at the very beginning in 18 districts, really designed to support the doctors in deliver the healthcare, spend more time with people, spend more time with families through the NGOs and also through the professionals. So all the DHC basically are designed to welcome as a welcoming hub for the entire family, including youth, middle-aged and elderly, women, men, adults and kids. We also developed a reference framework to see how the services can divert from individual care to family health care. So we developed the reference framework as a life course preventive care, which include the preventive measures at the different age and also with different genders at a different time. For example, we just established the Women Wellness Satellite Login Zam as part of District Health Center. We try to build a system to see whether it can entertain the people who are really in need. It's not only the people who are rich, well off. We also want to target the underprivileged. So in the GOPD, General Outpatient Service, we are going to open 18 general outpatient service for underprivileged people so that they can receive the chronic disease screening as well as women's health. In the district health centers, we try to connect with the women wellness centers and see whether we can also cater the health needs from the family people who really need that. So we hope that the district health centers network can help those initiatives. We all know the inverse care law. I learned from our teaching in the school that underprivileged people have higher health need but less access to healthcare services. So as part of healthcare reform, we shall reposition the public hospital system and with the primary care to address the issue by expand significant number of people eligible for medical waiver. So we understand nowadays we really want to know how those waivers can be arranged for the people, because it's already more than 2 million people in our estimation that they were eligible for our public healthcare system. So we need to reposition our service to underprivileged people, but however, in the same time, we also need to develop a community system to cater the health need of general public. So those are the challenges. We hope we can work together and work with NGO partners and see how we can deal with that. In powerful parallel is our shared belief in empowerment through the health literacy. The ultimate goal of Primary Healthcare Commission is to foster self-health management and preventive care. So we call for active individuals who take the primary responsibility for their own health. JCSATH excels in building the confidence and skills within the community and ensure that health literacy is not just disseminated, but effectively applied within specific cultural contexts. We really need to see how we can make use of this model through different platforms and empower the families who really need the knowledge to adopt a healthy lifestyle and behavior in every single day. So recently, we also try to amend the e-health ordinance and try to see how e-health platform can really become a platform between the public and private, become the community and the healthcare, and also between the family and the individual health. So this is the one project we try to see whether we can enable the online developments, because we know that different cultures really need a different approach. JCSATH project commit to build the capacity building for healthcare providers and also as a community navigator, such as NGO and volunteers. We understand the healthcare professional and community partners really need to enhance the skills to deal with the cultural sensitivity, and also need to have practical tools to create a more empathetic, responsive, and effective support network. However, this investment in human capital is really difficult, but we really need to deal with it because it is a fundamental for our sustainability. We need to have personalized approach, which is absolutely key to achieving a positive long-term health conditions. So as a commission, we really want to see how primary health care can build a system and also disrupt the system. And then we see how we can learn from the university with your research finding and results, and try to see how we can exemplify and also expand the innovation to our community. And also can demonstrate the culturally competent models that contributes to the advancement of healthcare system in Hong Kong. May I extend our most enthusiastic congratulations to the JCSATH project team, all the implementing partners, dedicated professionals, and community members who involved. We are deeply proud and committed to this essential partnership. Let us move forward together, building a healthier, more resilient Hong Kong for everyone. Thank you so much.
Thank you, Dr. Pang, for being with us today and sharing your valuable thoughts. We proudly welcome you back to your home school.